Okay, so I am not the one who usually gets to do the speaking. I'm the like stay in the office and make sure everything runs smoothly person. So you'll be gracious with me a little bit. I just want to tell you a little about Refuge, what we do, why we do it, and then kind of what's so special and important about Refuge, and if I have kind of a call to action at the end, maybe anything, if you feel compelled to help support the agency, how that might look. So we, Refuge, we actually are just starting our 8th year in service. We started as a very small grassroots organization to fill the gap after another program lost funding, and there really weren't the available services in the community. And so we're pretty new as far as nonprofits go and services. So we provide services to children and families in Madison County that have experienced trauma. So they're kiddos who have experienced or been exposed to domestic violence, who maybe have a parent who's struggling with substance addiction, maybe some other traumatic event in their life. A lot of our kiddos that we work with have had either some physical or sexual abuse in their life. And our mission is to wrap around those kiddos and families in our community. So we do that through counseling for the children, what we call caregiver support, and I'll tell you a little bit about that. So our counseling program, we do a parenting education program for parents who are either at risk of or have lost custody of their children already and are working toward kind of gaining that custody back or some stability in their family. And then we also provide kind of professional development to educators and school districts, people that are working with these kids in school every day, and then doing some education in the community and speaking at community groups. So those are the ways that we kind of approach this issue. Just to give you kind of a few statistics about why it actually matters is that Madison County, I don't know today where we stand, but a lot of times we are number one. We kind of flip-flop with St. Clair County, but per capita children compared to our population in the state of Illinois for kids in foster care. Like, I mean, you compare that to other, like even Chicago and stuff, we just have that high of a volume of kids that are exposed to trauma and are in foster care. So we've got a lot of kids that are living with foster families, grandparents, aunts, uncles who didn't necessarily expect to be raising a child, especially a child that has trauma and kind of all the things that go along with that. So we have some other populations of kids that we work with, a lot of kids that are still with their families, their biological families, and so we're working to support those families too. But I think one of the special things about our program is that in addition to the counseling that we do, we provide that caregiver support that I mentioned. So for every kid that comes into counseling, they also get someone who meets with their caregiver, whether it's their parent, their grandparent, aunt, uncle, older sibling that's now caring for this child. We wrap around that caregiver as well. So kiddo doesn't just go into counseling and come out, and that caregiver is just still kind of left on their own. They get someone to give them some education around like the effect of trauma on a kid and child development, and why, kind of how to understand the behaviors that might be coming and what's going to be different and the special needs that a child is going to have after having some of that experience, and help them with some parenting strategies to like work on attachment and connection and kind of just really supporting that caregiver. And this is the model that we've like really like supported and given in or like bought into, because what do we know about kids? Like, I mean, you ask a kid, you ask my daughter, she's in charge, but we know that kids are not in charge of their own lives, and they're really at the whim of the adults in their lives. So if we can support the adults and really give them the tools that they need to help kiddos grow up healthy and happy, we're going to be making even more of an impact for those kids than we can just by 1 hour of counseling every week. So as a social worker, as the clinical director, I will say like the counseling that we're providing to these kids is phenomenal. The therapists that we have are some of the best that I've ever had the opportunity to work with. And we have some art therapists on staff and therapists that are trained all in some of the most cutting edge, like trauma treatment modalities that are out there as far as research. And so the kids are getting really good counseling. Caregivers are getting really good support. Our parent education classes is very well respected in the court system. We're always getting referrals from, especially the Madison County courts that have parents that have needs. So we see kids up to age 11, and we have that age group because we know that studies show that 80% of kids that experience that trauma before the age of 11. So if we combine that with what we know about brain development, child development, the kind of essential things that are happening for a kiddo before they turn 11, as far as what they're learning about, like social emotional needs and all of that, it's really a crucial time for that early childhood intervention. So that's why we've got our program that way. So that's what we do as far as services, and I can answer some questions after if you have questions about that. But what my favorite thing to tell people whenever I talk about Refuge and the services that we do, and what I really want to tell you all about, I think what makes Refuge so special is actually what the coach that was talking about the student earlier was talking about our community and what a wonderful community this is, and the work that you all do. I didn't grow up in Madison County. I married into it. I have learned to love this community so much because when there is a need, we really rally around one another. And I've seen that in lots of ways over and over. We're an incredibly generous community and a very supportive community. We have our flaws, everybody does, but overall, we're doing pretty good. And I see that with Refuge and the way that we're funded. As an agency, we get no federal and no state funding. We are 100% funded by our community for our community. So all of our funding comes from individual donors, from foundations and businesses within our community. We get some funding through the County Mental Health Board, which again, our community dollars at work, to provide some services at schools and in the community for those kids that can't make it into our office. So people are just blown away when I say that. All of our services are free too. We don't take insurance. We don't do any of that, and we don't want to, because when we don't have to be bound by our director calls them the golden handcuffs of being bound by having to make diagnoses, by having to be set a certain number of sessions with a kid. If somebody else telling us that, we get to be really client-centered and focus on what family needs. And it's accessible to any family. So regardless of their financial situation, anyone can access our services because the community has said, this is a need that we see in our community, we're going to support that. So I think that's really special. And I always want people to know that because they're just blown away by it. I think it's important too because trauma is so prevalent. My guess is every person in this room probably either is or knows somebody who's going through something pretty hard. And we all just are walking out of, maybe not walking all the way out of, but COVID over the last couple of years and the way that has impacted some of our families. So we all know that trauma does not discriminate. Trauma affects our kids, trauma affects our neighbors. It's not what happens in the next community over. So that's why it's helpful for all of us. Even though our office is in Edwardsville, we see kids from all of Madison County. We see kiddos in Edwardsville and Troy and Highlands and all of the communities in Madison County. So I'm going to tell you, we've got, one more thing. I'm going to tell you how many kids we see. So with our 100% funded by the community services, and just last year, and all the restrictions we had around meeting and not meeting and everything, we were able to treat in our counseling program 230 kids and their caregivers. That's quite a lot of kids just in our counseling program. And over this last 7 years since we've started, we've seen 873 kids in counseling. And there's such a need, that's a lot of kids for one county. And right now we have a waiting list with 41 kids just waiting to get started with counseling, and there's an opening. So sometimes I think people don't realize how much of a need there is and how much trauma is actually in the community around us. I just wanted to tell you that, like, that's a lot, and for a very small organization to see that many kids. So we have in April, if you're thinking about how you might partner with us or support us or anything, we're always, you know, asking people to consider being monthly donors, becoming partners with us financially, other ways that you can come alongside us. Is we always have an annual fundraising dinner. We have it coming up in April 7th. I have some pamphlets. If you are interested, you can grab one. It's not a ticketed event. The best way that you can partner with us is just to commit to having a table, to being a table captain and saying, yes, I will bring, I think there are tables of 10 people from my circle of influence. And you bring yourself and your partner, and you've got 8 other friends or coworkers that you can bring along with you. Thank you. It's a fundraiser. You will be asked to donate at the fundraiser, but just coming, and it's a chance to hear about the work that we're doing. We have usually a panel of some of the clients that we work with and people from the community that we're doing the work with. So it really is a chance to hear stories of like the need that's in the community and how we're meeting that need. So that's on April 7th. If you would be interested in being a table captain, there's information coming around. You can email us with that information there. So there also, I don't have information for it. And so if you're a golfer, they have a golf tournament in September. Oh, I saw it. Ear pricked up. Okay, it's in September. It's always the last Friday of September. It's at Belt Park in Wood River. And I almost shouldn't say this because I might jinx it. Every year we've had it, it is like the most gorgeous day of the year. It's always beautiful weather, the perfect day to be out on the golf course. So if you're up for golfing on a Friday afternoon in September, tuck that in the back of your head.
And Megan, hey, don't be afraid to say it fills up.
Oh, yeah.
It's a very well attended term.
It does. Jared.
I'm terrible, but yeah.
I was about to say, Jared's very competitive, but that's true.
Yeah.
But he's always there.
Yeah.
September. The last Friday in September, 20 something. So yeah, so we just really want to spread word about the organization. It's a great need in our community. I'm biased, but it's a phenomenal organization. And like I said, my favorite part is that it is funded by our community for our community. So that's Refuge. If anyone has questions about Refuge, I'm happy to answer.
So the kids that come in, they can either be in foster care or still living with their parents?
Yes.
But the foster parents don't need extra counseling.
No, the counseling is not for the caregivers. I mean, we just say caregiver because it's parents, foster parents, and whoever is caring for the child. It's not counseling, it's really support for them and helping the child. So, foster parents.
Counselors are not.
No, oh no, good question. All of our counselors, we have 5 counselors on staff, and they are all like professional licensed counselors. 3 of them are art therapists. And something I think is exciting that we haven't really advertised, and I didn't mention, we spent this current school year piloting a program with the Roxana School District where they contracted with us to have a therapist. We've worked with them a lot, and just had therapists kind of pushing in for services for some of the kids in that school district. But they contracted with us to have a therapist there full time for their school district. And what we have seen this school year is that there is such a need in every school district, but specifically this one, this is where we're working, that we've renewed that contract with them to have 3 therapists in their school district for next year. So we're really excited about changing the culture in that specific school district. So we're hopeful to maybe continue that program. Yeah. Yes.
Do you or did you used to work under like the umbrella Riverbend Family Ministries?
Oh, that's a good question. So we are housed in Riverbend Family Ministries. The way it works is they are like an umbrella organization. So we're separate organizations, funding and like organizationally, but they provide housing for small nonprofits. So we don't have to pay for rents, utilities, things like that, like we would have to pay if we had our own brick and mortar location. So they're amazing partners of ours, and that allows us to, have another therapist and see more kids than we would be able to if we weren't us there.
I'd like to thank you, Megan, for being here for the presentation.
Thank you all for having me.
Also, on behalf of the nursery and the Slusser family, I'd like me to take over today's service.
Okay.